I'm glad to be here today and just want to share some of our insights from South Africa and some of the experiences on HIV self-testing. The topic is entitled Moving from Product to Policy to Program, because essentially that's what we're trying to do currently in South Africa, and as you'll see, we are doing a little bit of everything at this point in time. So South Africa is in a very unique situation at the moment. The Department of Health, through the Deputy Director General, has been very explicit in where we are with self-testing. And we've heard this countless times today already. South Africa will only implement HIV self-testing in public health when there are WHO pre-qualified products available. And we are all asking WHO PQ to go as quickly as possible. We know there are processes that have to happen, but in order for us to get any sort of scale, and if we are going to deliver HIV self-testing at scale or scale up self-testing, then we are certainly going to require WHO pre-qualification, not only for the oral-based product, but for any product that's currently in the pipeline. Whereas we have something else happening in the private sector market in South Africa, which is quite weird, actually. We have, in December 23rd, 2016, we had pharmacists in South Africa now allowed to sell HIV self-test screening tests under the guidance from the South African Pharmacy Council. So this was the only barrier that actually existed in the market. Because South Africa doesn't have a regulatory framework, regulatory body such as the FDA or a CE marking process, the MCC in South Africa doesn't have jurisdiction over medical devices. And therefore, it's left us with a bit of a gray zone. We have the public health on one hand, and we have private sector strategy on the other hand, and they're at very different places at this point in time. Having no regulation in the market and the Pharmacy Council now allowing HIV self-tests to be sold in the market has resulted in us seeing products enter the market, and I'll come to that shortly. From the public health sector, this is a snippet from the Minister of Health's presentation to an interministerial committee meeting last month. And the first point on his slide on HIV was the introduction of self-screening for HIV, as the department is calling it, also called HIV self-testing. So this shows that HIV self-testing has been included in the National Strategic Plan for South Africa for the next 5 years. So South Africa has to get going on it. The minister is taking this really seriously and has included, got him to the stage of including it into his IMC presentation. So we certainly know that this is on the horizon. So in South Africa, we've had products that have been available informally for many years. For the last 4 to 5 years at least, you could procure products under the shelf, if you want to call it. Informally, you could procure products over the internet, at the airport, and in various other places. And we've seen some of these products. Whilst we have groups such as those that presented earlier, which are really trying to optimize products and get them as usable as possible, you know, we're splitting hairs on wordings, on instructions for use. And then on the other hand, you just have a product which is a repackaged professional product, or not even a professional product, that's been put onto the market and been sold, and instructions for use are really complicated, and nobody's doing a thing about it. So that's created a lot of red flags for us. The Pharmacy Council ruling, as I said, has been a bit of a curveball that's thrown into the industry. The lack of defined regulatory framework, we do not have a body, but we're hoping to have a body quite soon as in what we call SAPRA, the South African Health Product Regulatory Authority. The position of the Department of Health has been that we will wait for pre-qualified products before we can implement in public health, and that's been one of the barriers that we need to overcome in order for us to start getting to a stage where we can start implementing and scaling up. The WHO have moved very fast and have got us the normative guidance, and that spurred us on to getting the South African guidelines in place. South African guidelines are currently in draft and hopefully concluded in the next month or so. However, there has been a lack of evidence within the South African context, and not just South Africa, I think internationally, we still are striving for some data. OraSure certainly has a lot of data, and we've seen a lot of it, but we have a significant gap that we don't have enough blood-based product data available. And that's something that we're trying to cover in our little way. And then WHO pre-qualification is something we've spoken about already. So just touching on products, within the program, within South Africa, we've seen multiple products showing an interest in entering the market. Under our current program, we have not chased away any manufacturer and are willing to assess any product that has been presented to us. So to date, we've spoken to multiple manufacturers, because at the end of the day, if we're going to get scale, if we're going to demand prices be dropped, we are going to require competitors into the market. If we're going to create a hype around self-testing, we're going to need more than one product. So getting as many products into the pipeline for WHO pre-qualification is the ultimate goal. So in this, we have a variety of both blood and oil-based products, and these products are all trying to generate the necessary data for their pre-qualification submissions. But whilst all of this is happening, we have this on the market in South Africa. We have these substandard products that have been allowed to be sold, and there is no policing mechanism stopping these products. As you can see, the instructions for use are not really user-friendly at all. The products are just thrown together, bits and pieces thrown together. The information on the packaging and labeling is not sufficient. And we believe that this can do more harm than good for the industry as a whole. And we're doing our little bit to try and stop this from happening. I know the Department of Health has been engaging with the Pharmacy Council to try and stop this as well. So the product pipeline is there, some of it good, some of it bad. And we need to make sure that we allow the good products to enter the market by ensuring that they robustly assessed and supported. In terms of policy, there's a lot that needs to happen for policy to be completed. We, as a South African policy technical working group, merely recommend to the Department of Health what we think the guidance around self-testing should be, and hope that the Department of Health then adopts it. We're currently busy with that process, but in order for that to happen, quite a bit needs to happen in terms of clinical-based evaluations, social science-based evaluations, and as a colleague, Anele, spoke earlier today, there are a lot of questions still to be answered in the South African context before we can actually start implementing self-testing in South Africa. The creation of SAPRA is a really, really important step for us. We need some sort of gating mechanism to ensure that good products are allowed onto the market and bad products are kept out. And when that happens is anyone's guess at this stage. The transition from the Medical Control Council to the SAPRA is set to happen the next year, but I have it in good authority that HIV self-test is going to be considered a priority product and will be one of the first products that will be assessed in terms of the new medical devices regulation. The South African group has been, and as VHRHI, we will be writing to SAPRA on what has been done on HIV self-test, because we don't want them to go and recreate the wheel, so to speak. And the DOH has moved on policy as well. Just some highlights from what we have in the policy document. The development of policy and guideline is the responsibility of the National Department of Health, but the technical working group has developed these recommendations. And under the recommendations, we have specific guidance for distributors of self-tests, guidance for implementers, guidance for manufacturers in terms of what's the minimum requirements for their products, the minimum messaging that needs to be included on their packaging and instruction for use. And importantly, how do we control this in terms of post-marketing surveillance, and what are the key messaging that we want the instructions for use to speak about? In terms of programs, the distribution models for South Africa, and there was a slide earlier which said there's no one-size-fits-all approach, and we certainly agree with this. The distribution model that will be used will depend on the population targeted and based on the testing gap. What's going to work for adolescents might not work for young men, might not work for sex workers, might not work for MSM. So you have to look at the specific target population that you're looking at and design your distribution model that's going to work with that, using the various tools and approaches. So we're very glad to be part of the STAR Phase 2 in South Africa. We joined the PSI Consortium on the UNITAD STAR 2 project that's going to take place. And that will be looking at integrating HIV self-testing into our national policies, developing evidence-based strategies, implementation plans, and facilitating regulatory approvals of HIV products to drive up scale. So it's building on the work that we're currently doing under our Gates, Bill and Melinda Gates Foundation budget, and trying to get HIV self-test scaled up, and we want to develop models throughout the country. We have identified key and under-tested populations in South Africa that we will target through STAR Phase 2, young men, adolescent girls, workplaces in South Africa where you find the majority of men, big business such as mine in the transportation industry. We have a growing transgender population, especially in the Western Cape, MSM, and then index partner cases. So just an example of how we're going to go about looking at this. If we look at young men, and while we're saying one size doesn't fit all, for young men, there will be several distribution models that might work, which need to be tested. Community-based, peer referral, VMMC, sports events, which are spoken about earlier, partner delivery, and internet-based. But then if you move to adolescent young girls, that changes, and the distribution mechanism needs to change as well. So under the program, we'll be designing the distribution models to fit the different populations and seeing what works and what doesn't, so that we can inform the National Department of Health on when, after 2019, UNITAD are no longer funding a program, for example, how does the Department of Health carry on with the distribution of HIV self-test? What mechanism works, what mechanisms don't work? And we're hoping that the program will answer those types of questions. We're busy with development of several support services as well, in conjunction with the work that's been done globally, mobile apps and other communication platforms such as social media and WhatsApp. Internet, we've developed a website specific to South Africa, which will be handed to the Department of Health to control, upskilling the call centers in South Africa to deal with HIV self-testing, and training of peer educators. So I'd like to thank my colleagues and all the various donors and funders and consortium partners. Thanks.
Good. Thank you so much.